Well, today we'll be talking about the drugs and the SIR of histamine and antihistaminic agent. So, what is histamine and antihistaminic agents? So, histamine is a crucial biogenic amine stored predominantly in mast cells and basophils, playing a significant role in local immune systems, gastric acid secretion, and neurotransmission within the central nervous system. However, antihistaminic agents are a class of drugs designed to counteract the effects of histamines by blocking its receptors, so thereby elevating histamine-mediated symptoms. So these agents are primarily divided into H1 and H2 antihistamines, with H1 antihistamines commonly used for managing allergic condition and H2 antihistamines utilized in the treatment of acid-related gastrointestinal disorders. Now let's go on to the drugs of antihistaminic and histamine. First, we have the diphenhydramine, or also known as the Benadryl. So, diphenhydramine Benadryl is a first-generation antihistamine that works by blocking histamine H1 receptors. So, it prevents allergic symptoms like itching, sneezing, and runny nose. It also has anticholinergic effects, causing side effects such as dry mouth and sedation. Its ability to cross the blood-brain barrier leads to drowsiness, making it useful for insomnia. And we also have antiemetic properties to help with nausea and motion sickness. And lastly, we have the local anesthetic effects for topical relief for pain and itching. While effective for allergies, sleep aid, nausea, and skin irritation, its sedative and anticholinergic effect can limit its use in some individuals. Now, what is SAR? Diphenhydramine or Benadryl. So, diphenhydramine is an ethanolamine derivative with a structure that includes two pentyl rings connected to a central oxygen atom. So, we further link siya to ethylamine side chain. So, the two aromatic rings are essential for binding for the H1 receptor as they interact with hydrophobic regions of the receptor. The outer linkage between the rings and the ethylamine chain provides flexibility, allowing optimal position for receptor binding. So the basic amine group in the ethylamine side chain is crucial for forming ionic interaction with the receptor. Additionally, the lipophilic nature of diphenhydramine, due to its aromatic ring and flexible chain, enables it to cross the blood-brain barrier, contributing to its sedative effects. Modification of the structure, such as replacing the phenyl groups or altering chain length, can significantly affect its potency, selectivity, and side effect profile. And this is the example of the diphenhydramine or the Benadryl drug, as you can see in the next page.
So, good day everyone. Today I'm going to talk about the cetirizine, its mechanism of action, and SAR. So, the mechanism of action ni cetirizine is it blocks the H1 receptor. So, this prevents histamine from binding to its receptors, which then dili maka-exert si histamine sa iyang effect such as vasodilation, increased vascular permeability, itching, and inflammation. Since dili man niya na ma-exert nga effect, then na-reduce of kuan like sneezing, runny nose, and itching. So, ang usa pod ani is si cetirizine guy is less sedation siya kay dili siya maka-cross sa ato ang blood-brain barrier. Good day everyone. Today we're going to talk about the SAR of cetirizine. So, cetirizine works as an H1 antihistamine due to its key structural features. The first one is two aromatic rings. So, kani siya is iyang i-help si cetirizine in binding to H1 receptor through hydrophobic interactions. The second one is piperazine ring. So, kani siya is iyang i-increase ang binding strength and selectivity for H1 receptors. And the third one is carboxyl group. So, kani si carboxyl group, iyahang himuong kuan ka ng less likely to enter the brain and reducing sedation. The fourth one is ethylamine side change. So, kani siya iyang imimix si histamine allowing competitive blocking of H1 receptors. And the last is chirality or enantiomer. So, kani siya is more potent and longer acting than the S enantiomer. And Why is it important the eye? Kani siya nga mga features, this makes cetirizine a potent, selective, and non-drowsy antihistamine used for allergies.
Azelastine is a medication that primarily serves as a selective antagonist of histamine H1 receptors with some effect on H2 receptors and is used to treat allergy symptoms. Histamine H1 receptors are a type of receptor that interacts with G proteins and are located in various cells, including nerve endings, smooth muscle cells, and glandular cells. When an allergen enters the body of a sensitized individual, it triggers the cross-linking of IgE receptors on mast cells, leading to the release of histamine. The histamine then binds with the H1 receptors, causing common allergic reactions such as itching, sneezing, and nasal congestion. While the main action of azelastine is through blocking H1 receptors, it also influences other pathways related to allergic responses. It has been shown to stabilize mast cells, preventing the release of inflammatory substances like interleukin 6 and TNF alpha. Additionally, azelastine reduces the production of leukotrienes, substances that contributes to inflammation in patients suffering from rhinitis. Studies indicate that it can inhibit the release of these mediators from eosinophils as well. Moreover, patients using oral azelastine has been demonstrated lower levels of substance P and bradykinin in their nasal secretion. Both of these substances are associated with nasal itching and sneezing in allergic rhinitis cases. Overall, azelastine not only alleviates symptoms by blocking histamine, but also plays a broader role in modulating other inflammatory processes involved in allergic reactions. Azelastine hydrochloride is a compound that belongs to the phthalazine family, characterized by specific structural features that contributes to its pharmacological activities. First, it has oxo group at the 1 position, a methylazepine 4L group at the 2 position, and a 4-chlorobenzyl substituent at the 4 position. These structural elements play a crucial role in its function as histamine H1 receptors, which are integral for mediating allergic responses. Phthalazine core, the phthalazine structure provides a stable framework for azelastine, allowing it to effectively interact with histamine receptors. This core structure is essential for its classification as an antihistamine. Oxo substituent, the oxo group of the 1 position enhances the compound's ability to form hydrogen bonds with the receptor, improving binding affinity and selectivity for H1 receptors over H2 receptors. 1-methylazepine 4-ale group, this moiety contributes to the lipophilicity of azelastine, facilitating its penetration through biological membranes and enhancing its bioavailability. The azepane ring also plays a role in receptor interaction, stabilizing the binding conformation. 4-chlorobenzyl substituent, the presence of a chlorine atom in the benzyl group increases the lipophilicity and steric bulk of azelastine, which is important for its binding characteristics and overall pharmacological activity. The structure-activity relationship of azelastine hydrochloride highlights how its unique molecular features contribute to its effectiveness as an antihistamine and anti-allergic agent.
Hi, this is Akish Michaela Tinskeda from Section B, Pharmacy, second year. Next, antihistamine agent, we have loratadine. Now, what is loratadine? Loratadine is a second generation H1 antihistamine used primarily for allergic reactions like urticaria and fever, hay fever. What is the mechanism of action of loratadine? How does it work? It works by selectively blocking peripheral H1 histamine receptors, preventing histamine from binding and causing allergic symptoms such as itching, swelling, and runny nose. Unlike first-generation histamines, loratadine does not cross the blood-brain barrier, significantly reducing sedation effects. It has a long half-life, which is 8 hours, and is metabolized in the liver through this loratadine, its active metabolite, which contributes to its prolonged action. Now, what is the structure-activity relationship of loratadine? The structure-activity relationship of loratadine is primarily defined by its tricyclic core, which provides high affinity and selectivity of H1 histamine receptors, which is essential for antihistaminic activity and stability. Next is the presence of ethyl bridge. Connecting the tricyclic nucleus to the piperidine ring enhances receptor binding and stability, contributing to its potent antihistaminic effects. Piperidine ring contributes to the long duration of action. It also helps reduces the CNS penetration, minimizing sedation effects. Additionally, the carbamate ester functional group increases lipophilicity, allowing loratadine to remain peripherally selective and minimizing central nervous system penetration, which reduces sedation. This structural design ensures that loratadine provides effective, long-lasting allergy relief with minimal drowsiness, compared to first-generation antihistamine. Overall, this structural design ensures high potency, minimal CNS penetration, and a long duration of action, making a loratadine a preferred choice for allergy relief.
So we have here fexofenadine, which is an antihistamine medication that comes in a capsule or tablet form. It treats and prevents symptoms of allergies like itchy eyes, sneezing, and hives. It works by blocking histamine in your body, and the common brand name of this medication is Allegra. So the mechanism of action of fexofenadine is to selectively antagonize H1 receptors on cell surfaces across various organ systems, thereby affecting inflammatory mediators. Compared to other first-generation antihistamines, fexofenadine crosses the blood-brain barrier minimally and does not cause drowsiness. As a second-generation antihistamine, fexofenadine exhibits reduced affinity for cholinergic and alpha-adrenergic receptors, which results in minimal anticholinergic effects. The structural activity relationship of fexofenadine is a piperidine-based antihistamine compound. It has a role as a H1 receptor antagonist and an anti-allergic agent. It is a member of piperidines and a tertiary amine. It is functionally related to an isobutyric acid. So fexofenadine is an over-the-counter second-generation antihistamine used in the treatment of various allergic symptoms. It is selective for the H1 receptor, carries little to no activity at off targets, and does not cross the blood-brain barrier. This is in contrast to previous first-generation antihistamines, such as diphenhydramine, which readily bind to off targets that contribute to side effects such as sedation. Fexofenadine is the major active metabolite of terfenadine and is administered as a racemic mixture in which both enantiomers display approximately equivalent antihistamine activity.